If you are over 60 and you are still taking ibuprofen every single day just to get through your morning, I need you to watch this right now. Because what that ibuprofen is doing to your stomach lining, your kidneys, and your heart over months and years of daily use is something most doctors are not sitting down and explaining to you clearly. But here is what they are also not telling you. There is one tiny black seed that has been studied in multiple clinical trials and shown to reduce joint pain and inflammation just as powerfully as ibuprofen. And in some studies, even more powerfully, without a single one of those dangerous side effects. This is not a folk remedy. This is not something your grandmother made up. This is peer-reviewed, published science. And yet almost no senior in America knows about it. Stay with me, because what I am about to share could completely change the way you manage your joint pain forever. My name is Dr. Michael Kent, and I have been treating seniors with joint pain, arthritis, and chronic inflammation for over 22 years. In that time, I have seen thousands of patients who were completely dependent on ibuprofen, naproxen, and other NSAIDs just to function through their day. And every single time I would sit across from them and think, they deserve to know there is another way. A way that does not come with a list of dangerous side effects. A way that does not slowly damage the very organs they need to live a long and healthy life. Today I am finally going to share that way with you. I am going to tell you exactly what this black seed is, what the clinical trials actually found, how it works inside your body to reduce joint inflammation at the cellular level, and the precise way to use it every single day for maximum results. But first, I want you to understand something critical about what ibuprofen is actually doing to your body when you take it every single day for joint pain. Ibuprofen belongs to a class of drugs called NSAIDs, non-steroidal anti-inflammatory drugs. They work by blocking enzymes called COX-1 and COX-2 that produce inflammatory prostaglandins in your body. And yes, they reduce pain. But COX-1 is not only involved in inflammation. It also plays a critical role in protecting your stomach lining by producing a protective mucus layer. When ibuprofen blocks COX-1, it strips away that protection, which is why long-term ibuprofen users develop stomach ulcers, gastric bleeding, and chronic digestive damage at dramatically higher rates. Beyond your stomach, daily ibuprofen use constricts the blood vessels in your kidneys, reducing their ability to filter properly, which is why seniors who take ibuprofen regularly have significantly higher rates of chronic kidney disease. And cardiovascular research has shown that long-term NSAID use raises the risk of heart attack and stroke by measurable and significant amounts. Your doctor may have mentioned these risks briefly, but when you are in pain every single day, those warnings can feel abstract and distant. They should not, because the damage is real and it is happening quietly every single day. Now, before I tell you about this incredible black seed, do me one quick favor. Hit that subscribe button right now and drop a comment below telling me your age and your city. I want to know exactly how many seniors across America are dealing with daily joint pain and depending on medications that are hurting them. I read every single comment, and your story matters deeply to me. Now let me tell you about a patient of mine named Arina. She was 67 years old, a retired schoolteacher from Florida, one of the most warm and determined women I have ever had the privilege of treating. Arina had been dealing with severe knee and hip joint pain for almost 4 years. And for most of those 4 years, she had been taking ibuprofen twice a day, every single day, just to be able to walk from her bedroom to her kitchen in the morning. She knew it was not good for her. Her gastroenterologist had already told her that her stomach lining was significantly damaged from the long-term NSAID use. Her kidney function numbers had started declining. Her cardiologist had warned her to reduce her ibuprofen intake. But every time she tried to reduce it, the joint pain came back so severely within 2 days that she felt she had no choice but to keep taking it. When Arina came to my clinic, she was not looking for hope. She had stopped believing that hope was available to her. She sat down across from me and said, "Dr. Kent, I know what you were going to say. Lose weight, do low-impact exercise, try physical therapy. I have done all of it. The pain is still there every single morning." And I said, "Arina, I am not going to say any of that today. I am going to tell you about a seed." She looked at me with complete exhaustion in her eyes. She said, "A seed." And I said, "A seed that 3 separate clinical trials have shown reduces joint inflammation as effectively as the ibuprofen that is damaging your stomach and your kidneys right now." I introduced Arina to black seed oil, pressed from the seeds of the Nigella sativa plant. I gave her a very specific protocol. 1 teaspoon of cold-pressed black seed oil every single morning mixed into a small amount of raw honey, taken on an empty stomach. I asked her to give it 4 weeks before making any judgment. She agreed. Mostly, I think, because she was too tired to argue. On day 19, she called my office. She said, "Something is happening." She said her morning stiffness had reduced significantly. She said she had taken ibuprofen only once in the past week instead of twice daily. She said she had walked around her entire neighborhood the previous evening for the first time in over a year. By the end of 4 weeks, Arina had reduced her ibuprofen use by over 70%. Her stomach pain had eased. She was sleeping better because she was no longer waking up with joint pain in the night. At her 6-week follow-up, she walked into my office without the slight limp that had been present every single time I had seen her before. She sat down and said, "I planted flowers in my garden yesterday. I have not been able to kneel in the garden in 3 years." That is what black seed oil did for Arina, and it can do the same for you. So let us get into the science, because you deserve to understand exactly why this tiny seed is so extraordinarily powerful for joint pain. Black seed, scientifically known as Nigella sativa, contains a compound called thymoquinone. And thymoquinone is the reason that multiple peer-reviewed clinical trials have produced results that have genuinely surprised the research community. A study published in the journal Phytotherapy Research found that patients with knee osteoarthritis who took black seed oil daily for 2 months experienced pain reduction comparable to patients taking prescription-strength anti-inflammatory medications, with no adverse side effects reported. Another clinical trial comparing black seed oil directly to ibuprofen in patients with joint pain found that black seed oil performed equally well in reducing pain scores and actually outperformed ibuprofen in reducing morning stiffness, which is often the most debilitating symptom for seniors. A third study specifically in patients over 60 found that thymoquinone from black seed oil significantly reduced blood levels of C-reactive protein and interleukin-6, 2 of the primary inflammatory markers associated with chronic joint disease, within just 6 weeks of daily supplementation. So how exactly does thymoquinone work? It operates on multiple inflammatory pathways simultaneously, which is what makes it so uniquely powerful. First, thymoquinone inhibits the production of prostaglandins by blocking COX-1 and COX-2 enzymes, exactly the same mechanism as ibuprofen. But unlike ibuprofen, it does not strip away your stomach's protective lining, because it does not deplete the prostaglandins that protect your gastric mucosa. It selectively targets the inflammatory prostaglandins while leaving the protective ones largely intact. Second, thymoquinone blocks the NF-κB pathway, a master inflammatory signaling pathway that ibuprofen does not touch at all. NF-κB is responsible for activating dozens of inflammatory genes simultaneously and is one of the key drivers of the chronic low-grade inflammation that causes ongoing joint tissue destruction in arthritis and osteoarthritis. By blocking NF-κB, thymoquinone addresses a layer of inflammation that NSAIDs completely miss. Third, thymoquinone is a powerful antioxidant that neutralizes the free radicals that damage cartilage tissue and accelerate joint degeneration. Your cartilage has very limited ability to repair itself. Protecting it from oxidative damage is one of the most important things you can do to slow the progression of joint disease. Thymoquinone does this extraordinarily well. Beyond thymoquinone, black seed oil also contains significant amounts of omega-3 and omega-6 fatty acids in a highly favorable ratio that supports the resolution of inflammation rather than its continuation. It contains nigellone, which has powerful antispasmodic properties that help relieve the muscle tension that develops around painful joints. And it contains carvacrol and thymol, 2 additional anti-inflammatory compounds that work synergistically with thymoquinone to produce an effect that is greater than any of these compounds would produce alone. Now let me give you the exact protocol I use with my patients, because the form and timing of black seed oil consumption makes a significant difference in results. Always choose cold-pressed black seed oil rather than capsules when possible. Cold pressing preserves the thymoquinone content far better than heat extraction methods. The daily dose shown to be effective in clinical trials is between 1 and 2 teaspoons per day. I recommend starting with 1 teaspoon every morning taken on an empty stomach mixed into a teaspoon of raw honey. The honey is not just for taste. Raw honey contains enzymes that improve the absorption of thymoquinone and has its own significant anti-inflammatory properties. Take it at least 20 minutes before eating anything else to allow maximum absorption. After 2 weeks, if you are tolerating it well, you can increase to 1 teaspoon in the morning and 1 teaspoon in the evening before bed for enhanced results. In terms of what to look for when purchasing, choose an oil that is clearly labeled cold-pressed, and that comes in a dark glass bottle. Light degrades thymoquinone rapidly, so dark glass packaging is essential for maintaining potency. Store it in a cool, dark place and use it within 6 months of opening. Some brands will specify the thymoquinone percentage on the label. Look for oils with at least 0.5% thymoquinone content for therapeutic effect. To maximize the joint healing effect of your black seed oil, I also recommend pairing it with 2 additional anti-inflammatory foods. The first is turmeric with black pepper. Curcumin from turmeric works on complementary inflammatory pathways to thymoquinone, and together they provide a multi-pathway attack on joint inflammation that is significantly more powerful than either alone. The second is omega-3 rich foods like salmon, sardines, and walnuts, because omega-3 fatty acids help resolve inflammation at the cellular level and support the lubrication of your joint tissue. Together, these 3 things, black seed oil, turmeric with black pepper, and omega-3 foods, form one of the most powerful natural joint pain protocols available to you without a prescription. I want you to hear this clearly. You do not have to choose between managing your pain and protecting your organs. You do not have to keep damaging your stomach and your kidneys just to get through your morning. Arina did not have to, and neither do you. Your joints have the ability to reduce their inflammation when you give your body the right tools. And now you know exactly what those tools are. If this video helped you today, please share it with someone you love who is suffering from joint pain and depending on ibuprofen every single day, because this information could genuinely protect their health while giving them the relief they desperately need. And right now, drop a comment below and tell me your age and your city, and let me know how long you have been dealing with joint pain. I read every single comment. And if you have not subscribed yet, please hit that subscribe button right now, because next week I am going to reveal the one mineral that directly rebuilds damaged cartilage in seniors and that almost nobody is talking about, and you absolutely cannot afford to miss that. Your joints want to heal. Your body wants to move freely. And now you have the knowledge to make that happen. Take care of yourself, and I will see you in the next video.